One of the more common things we see in our office is diabetic foot care. Diabetes is a very serious disease, and what I do is I explain to my patients that there is what we call the 3 strikes against the diabetic foot. Firstly, they have problems with circulation. So as the circulation decreases, they're at a greater risk of developing sores or gangrene in the foot. The second condition that diabetics typically suffer from is neuropathy, where the nerves in the feet stop to feel sensation as well as they should. And in those cases, they might not suspect or realize that they're having troubles or injuries in the foot or around some of the bony prominences in the feet. The third strike is that diabetics tend to have, especially when they have high blood sugars, an inability to fight infection. Their immune system is decreased. So they're at a greater risk of having an infection or developing an infection. What we try to do with our diabetics is educate them. Education is so important. So we work in coordination with the primary care doctors and the family physicians and the endocrinologists to assure that they are following proper foot care. And that includes inspecting their feet on a daily basis, assuring that they come to our office and have evaluations for checking their circulation, checking their nerve conductions in their feet, and checking to see if there's any pressure points or areas that might be at risk or a danger. Another thing that the Medicare program does, and something that most diabetics will take advantage of, is the diabetic foot program or shoe program. And what that does is allows diabetics who have a history and is documented by their family physician every year can take part in an office visit, and we can evaluate them for the fitting of the proper shoes. These shoes are special shoes in the sense that they're wider, they have more depth to them, they have no seams, and they can have special inlays put in them to avoid or prevent any sores or ulcerations from developing. So the key with diabetes is primarily to educate the patient, and then we always tell them early identification. They should be inspecting their feet on a daily basis. If they see something that's not right, they need to make sure that they get prompt treatment. So they need to show up in our office as soon as possible and make sure that we address that problem immediately.